Honorable adjudicators, Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. Today, I will be the first speaker from the opposing team, and our motion for today is, this House states that vaccines are only given to groups at high risk of contracting COVID-19. First and foremost, I would like to conceptualize and define the motion first. Young and healthy people are unlikely to get the vaccines. Dr. Sumya Swaminathan, WHO's chief scientist, said that the deliverers of the first vaccines would prioritize health workers from frontline workers and the elderly. He predicts that the world is expected to have at least one vaccine that is safe and effective by 2021. However, the number of these vaccines is available in limited quantities. Now I would like to define the motion that I have stated before. We can find some keywords from the motion such as vaccine, only, given, groups, high risk, contracting, and COVID-19. According to the Cambridge Dictionary, vaccine is defined as a substance containing a virus or bacterium that is not harmful given to a person or animal to prevent them from getting the disease that the virus or bacterium causes. Only means no others. Given or give means to provide someone with something. Groups refer to a group of people. High risk refer to high chance of getting something. Contracting refers to the infection of coronavirus, and COVID-19 refers to the disease that is caused by coronavirus. Today, we will be debating about vaccines can only be given to people that has a high chance of getting infected by coronavirus. I, as the first speaker of the opposing team, shall give my reasons on how everybody should get the COVID-19 vaccines. All people should get their vaccines for COVID-19. Why? Because everybody have a chance to get infected, right? If they are infected, they also have a chance to die because of COVID-19. And obviously, we don't want more people to die because of the coronavirus. From the data that I took from the government, as of October 26, 2020, in Indonesia, 13,411 people have died due to COVID-19. This is a definitely huge number. So, if the vaccine is only given to those who have high risk of COVID-19, how about those people with a lower risk of getting infected? I do acknowledge that the high-risk people are the ones that needs to be prioritized. But even those low-risk people still have a risk of being infected. Therefore, they still have a risk to die by COVID-19, and we obviously don't want that. If these lower-risk people don't get their vaccines, then they also have a risk of spreading their COVID-19 disease to other people. Some can also be just a carrier, no visible symptoms on their body. Therefore, they don't get treated to the hospital, and they can spread the disease to other people. So, if these people don't get their vaccines, they can spread the disease to other people, thus making the COVID-19 pandemic longer and longer, and it's gonna seem like it's never ending. A longer pandemic can also have a huge impact on the world. Problems like socio-economic, etc. will get bigger and harder to solve. Countries' chance of declaring a recession will also get bigger every day. So, to summarize my arguments, giving COVID-19 vaccines only to those who have high risk of infection is not a good idea. This is because by doing so, the trend of infection will keep on going and death toll will raise up every day. And last but not least, socio-economic problems will become bigger and bigger. Therefore, I stress again that COVID-19 vaccines has to be given to everybody, not just those who have high risk. That's all from me. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.